My dear colleague, it's a great honor and great pleasure for me to share a few information about the way that I use APTOS threads. So welcome everybody, and thanks to APTOS company for this invitation to share a few information about this. So for the one who do not me, I'm Dr. Eric Essayagh. I live in French Riviera, and I have my private clinic for over 20 years. Most of my activity is face treatments using fillers, botulinum toxins, threads, lasers, and peeling. I do also body cares. And I teach also to university in the Medicine University of Nice, in the University Diploma of Face and Neck Injection. I'm also a speaker for several laboratories, and usually a key opinion leader for Galderma company and other company like Essayagh also, who provide the APTOS thread in France. Thanks to those. So what about the threads I use? I use regularly APTOS Excellence range and light leaf threads. Why? Because it's polylactic and carbonolactone product plus hyaluronic acid, and we can use it with a very small cannula and soft needle. There is no exit point with cannula, and they provide us a complete kit ready to use, so it's easy to use in my office. And I do threads for more than 15 years, not APTOS at the beginning, and I have chosen APTOS for this reason. Is first of all, it's reasonable but long-lasting effect, up to 18 months to 2 years, and they make a unique design. As you can see on the upper threads, the double barbs they made, and it's a unique design, and it makes the threads completely efficient from the beginning to the end. And not only half of the thread like we can see in the lower threads, where there is only one part able to stretch the skin, on the other it's just for fix the skin into the tissue. It's also technically possible to collect the volume up and give tension to the skin and improve skin quality by collagen stimulation for the polylactic acid and carbonolactone, and also elastin stimulation with hyaluronic acid. I have also a good feedback from the product. It's not a new product. It's on the market for more than 5 years now. And what I appreciate a lot is the serious teaching by famous surgeons and dermatologists like Constantine, George, Albina, Murat, and Luciano, and I have to thanks to them, because I learned a lot with this famous personality. And then I have chosen APTOS, even with the COVID. At the end of the confinement, we stay completely blocked for 6 weeks in France, and we restart our activity since the 12th of May. And I still use it, because I don't see any sign of adverse effect with COVID on the skin of my patient with filler, botulinum toxin, or other treatment like threads. We just follow the instruction. We wear masks, we wear everything, a screen. We use also protection. And it's the normal way, it's near the normal way that I do the thread, except with the screen. But most of the time, we are always in this situation. So what is the goal with APTOS threads? First of all, we have the opportunity to give tension to the tissue and replace the volume at the right position and improve the skin quality. As you can see, this young woman, 40 years old, this is on the left before, 2 days after in the middle, and 2 months after, where we can see how these threads are able to enhance the skin quality. Also for the aging process, we have to remember that for the oval, the quality of the oval depends on the volume loss or the volume movement. about, it depends also about the skin laxity. It depends about the muscle, if the muscle become more lax, and also the ptosis of the submandibular gland. So when we see this young patient, how can we imagine to inject filler instead of threads? Of course, we must use threads to replace this volume at the right position. And if the volume in the cheeks are near good and she don't have a big budget to improve his face, just using the light lift threads like this can improve it a lot, as you can see with this result, or this result, or this result also. And other kind of patient who comes to my office are often too much injected. And this is not, for me, a very good effect when the light points are not at the right place. As you can see, it's too much volume in the cheeks, and also the skin quality is not so good. Instead of put the light point at the right position, we want also to achieve a makeup effect and put the light point at the right position. It means the culminant point. This is a photo with a flash. And when you use flash, we can see exactly where is the culminant point of the cheek. And we have to replace it at the right position. So not here, we prefer put the light here and here. And also there is no shadows to delimit the different aesthetic area. There is no shadows here, no shadows here, instead of what we can see. So I decided to use threads in this patient. And she will ask what she feels for the next 2 days. It's in French, but I can translate. She just explained that she feels a little bit tension and sensibility to the skin. So I just use APTOS threads and also fillers where I inject in the both mandibular angle just to achieve better proportion in regards of the side of the lips and make it better. I also do a kind of light peeling, a kind of exfoliation with laser named Spectra Peel. We improve a little bit also the skin quality. So the goal is to respect and follow the rules of natural beauty. So how I choose the APTOS thread? If I have only a light, soft tissue ptosis without any other side, I will just use the Excellence Visage soft threads. It means 10 threads, 5 and 5, from 1 to 2 points, just to push up the tissue. If I have a marionette line with the ptosis, I will use Excellence Visage, but longer size, it's 19 centimeters. If I have a sagging associated, it means that I don't have a very good curve of my oval. I have here, we call it fanon in French, call it sagging. Then I will add the light lift thread plus the APTOS Excellence Soft. If there is volume loss associated, of course, I will use filler because we can combine filler, hyaluronic acid fillers with the threads without any problem. And if I have only laxity of the lower third and the volume of my cheeks are okay, I just use the light lift thread. So when I do the filler, I use my own repair. I call it a butterfly concept because the repair seems like a butterfly. In the center of my butterfly in white position, I will use a firm, very firm filler. In my range I use, it's Restylane range, I use Restylane Lift on the white position. And I will use to Restylane Define in the pink repairs on the both wings of my butterfly in additional time after the fillers. So let's look to this first patient. Shows she has aging sign where the volume move down, and I decide to use in his case 10 APTOS Excellence Soft and 2 light lift threads with 2 entry points. So I was teaching in France, but also in Georgia, and I follow carefully the instruction I have and clean carefully the face. I use also sterile kits to be very comfortable to put the thread in the right position. So we do local anesthesia with 2 entry points per side with lidocaine. And then I will continue my anesthesia after 1 entry point made with a small needle, 18G needle. And I continue with a smooth cannula, and they provide this cannula in the kit, and it's very comfortable cannula. It's not so soft, not so hard, and it finds easily the right plane, and the right plane it's under the dermis layer, in the hypodermis layer at 4 millimeters on average under the skin. And we can find easily the plane and continue the anesthesia for all the threads. When it's done, I will start by the top with excellent soft range. And my free hand is very important to collect the tissue up before removing the cannula, and make also small curve with the cannula and make a kind of boucle to introduce all the threads through the tissue. If you can see carefully, I have write some curve with the threads. So the curve is very important because this is the good way to collect the volume up. And we go first down, then when I remove the cannula and I have to go again into the skin, I go more superficially. So we have the opportunity to put this volume in this position as we can see. So this is very easy. There is no exit point for APTOS Excellence Visage Soft. It's 10 centimeters longer thread. And we have also, we can decide just to give tension to the skin or collect the volume up. It depends what we want to achieve in this case. For the light leaf threads, they are very easy also to use. We enter the both needle, soft needle, in the same entry point, and we follow the direction. And there is 1 exit point in per side, and we have to just pay attention about not to be too much superficial or too much deeper. So here we can also control our position, moving the needle through the tissue and avoid any attraction of the skin when you move the needle. So we can do exactly the same for the other side. And with the both exit point, we have the opportunity to precisely give tension to the skin and make the oval more firm. Don't forget the small hook when we do the second, when we put the second needle. So it's not a V, it's more a U that we do. And the hook is very important because so that it will stay, it will be more efficient like this. This is the end of the process. As you can see, there is no side effect, no big bruising, no hematoma, no redness. It's just a little bit edema because of the anesthesia. I just put some strips to avoid any infection with hair we come into the hole, and this is the immediate result. And as you can see, for this result, we collect the tissue at the right position, we give tension to the skin, and 2 days after, we improve a lot the skin quality. This is another patient. This is older man with a lot of aging side, and we decide together also to improve the skin quality and replace the volume at the right position. So it's always the same case. We use the both Excellence Visage method, soft and light lift. And just I show you a second time this treatment because for man or woman, it's the same aging process. So as we decide to replace the volume to give tension to the skin and improve the skin quality, we do exactly the same kind of repair, kind of treatment. And we have to just control where we put the cannula down almost superficially in the cheeks if we want to collect the volume up or just give tension to the skin. And for the light lift is the same also. So I wrote with my draw first a curve, but when I introduce my needle, my assistant lift the skin and the curve become right, and then it's very efficient to collect and push the volume up. This is the end, and you will see him after a few days, after 1 month. For the immediate result, it's really impressive because with this soft procedure, without cutting any tissue, without getting any bruising, we achieve very good result that we cannot achieve with other techniques and threads and APTOS threads, I think. But we will see what's happened in the next day. So this is the immediate result. There is just a small edema around here. We make some folds, but this fold is not really a problem because after a few days it will disappear. And these folds are normal at the beginning because we collect the skin and we put the skin up so it makes fold. But what's happened after? This is this man after 2 days on the left photo, and this is after 1 week, where we start to see really the result. And this is this guy after 1 month. So after 1 month, he will be the skin is much better. We improve the skin quality. We improve also the laxity, but he will be yes in this position. And it's not like a surgical lift, but it's very good, I think. And we know that during the 2 months, the skin will continue to be improved. So when we just want to check the result is not only the question of skin laxity. And for this, I think that surgical lift is very efficient. But when we mixed skin laxity, replace the volume and enhance the skin, then with the thread we have a very good solution to improve aging sign. And then I will share with you 3 results from a younger patient to oldest. This is a young patient, so she starts without any other sign than a small nasolabial fold, and there is really not really marionette lines. There is something we start to begin. So I just use excellent soft range. So only 10 centimeters, and I do 2 entry points. I make 3, I do 3 threads up and 2 for the lower third. And this is the most simple treatment that we can deliver. There is no exit point, so no traumatic effect after the care. This is also less younger, but I still use the same range because I know that with this kind of threads, 10 threads, we are able to achieve a very good result. This is another case, more difficult. She has also a little bit some volume loss, and the distance between the entry point and the top of my trays is a little bit longer. So I decided to use the Excellence Visage. It's 19 centimeters thread. So this is the repair, the first result just after the care. And this is the result only after a few days, after 4 days, when she came for the control after 1 week, yes. And we have immediately given to his face much volume just by the inflammation, I think, and also the volume position at the right place. This is another interesting care because this woman started with fillers, but she had a problem with one of my colleagues who inject her permanent fillers, and then he had to destroy it. So he made a surgery and destroyed the filler he has put. Then after, she was afraid of the filler, and she told me about the marionette lines. So I decided to provide some threads. She trusts me, and we do first only Excellence Visage Soft range. So I do 5 threads per each side with this very good result, I think, at the beginning, because here we can see that we have the opportunity to replace the cheek at the right position, give tension to the skin, and improve also the marionette line. I just had 1 syringe of filler, not on his lips, because this is his own lips, but just around the chin to remove the shadow that we can see around the chin. This is the first treatment, and she decided to do another treatment, a second treatment, and another treatment. This is the 3rd treatment after 18 months. So on the left, we can see that she don't lose the total effect of the thread. She just wants to maintain it. And so we have the opportunity with APTOS threads to do it and do it again as we want to achieve better result, better tension, better firmity, and replace the volume at the right position. This is another case where I combine several techniques. I combine threads, fillers, and also laser to improve the skin quality, and also cosmetic cream to remove melasma she had after from many years. So it is not immediate result. There is 7 months between the both results. It's just to show that we can combine the treatment and achieve a very good result with time. For this patient, she only wants to improve the lower third. She don't want to touch the cheekbones, and actually the cheeks are not so bad. There is just a little bit rings, but okay. She had the budget just for the lower third, so I decided to use only the light lift. This is another difficult case because very heavy face with big marionette lines. And this is my initial result after using APTOS Excellence Soft on 2 light lift threads. But with time, with the fibroblast stimulation, the collagen stimulation, we achieve this result after 2 months. And you can see how the skin quality is really improved with the threads. This is another patient also with heavy face with better immediate result, where we can remove completely or near completely the marionette lines, but also on the neck. I don't touch the neck, I just touch my overall, and even at the beginning of the neck, we improve good quality. And this is the same patient after 3 weeks, as we can see for the results. Also on heavy faces, we can use the threads because there is enough threads with when we combine Excellence Visage Soft and Light Lift. It means that you are going to use 6 threads per side. So it's enough to support the tissue and push the volume up, give him immediate result, very good result, and improve the skin quality. This is oldest patient, 70 years old. She has different care. I do Botox and botulinum toxin on the upper third. I do plasma exerese treatment for the upper eyelid. I do 3 syringes of HA in the oral area, 1 will provide volume to the angle of the nasolabial fold and to the line of the oval between the chin and the sagging. I also use a very thin HA just to remove the fine lines, and specific HA for the lips to give a little bit volume, and threads. And this is the result after 6 months, where we can see that she kept a good result for the oval. This is another patient with difficult skin, because the skin laxity is very important in this case. So we replace the volume. Even if there is some folds here, it's not a problem, because all disappear after a few days. Sometimes, if you have small attraction like this, you have to follow the patient, of course, but it's not so, so difficult, because it takes 1 or 2 days before removing. This is all the patients. It's near 55 years old for the boss. One very good result, immediate result for the sagging here, and also very impressive result, I think, for this AV and fat face on the right side. This is my oldest patient, 85 years old. So the immediate result was good, but not so impressive. But when I saw her 2 months after, I was surprised, and she was happy like this, because we improve a lot the skin quality. So after using this kind of threads, I have to share with you, I have nearly no complication, but sometimes we can see small complication, but it's very easy to manage. As you can see here the top of one of my threads. When she smiles, the top of the thread pushed the dermis. I think it's because I cut it too superficially. I don't push the skin down with my knife before cutting the thread. So it's very easy to manage. I just do a local anesthesia like this. And then I think, yes, and then I will use just a needle and try to find the top of the threads and remove it and cutting it very simply. So we just clean it carefully, of course. So this is not really a big complication. This is it can I think I have done this twice on the series, and I've done a lot of patients, more than 100 patients, 200, 300, I think now. So it's very simple. I think that we have to think about all the process, and when we cut the light leaf, we have to pay attention to cut it not too near from the lines. We have to stay back from the lines, and take time to cut it well. So here you go slowly, and we try to find the top of the thread. And finally, we will find it, as you can see. The patient don't feel anything. So sometimes with the needle, we cannot find it immediately. So we have I just see the top of my thread. So with a small device, I try to exit from the skin. Here. Well, this is the thread. No, it's not an infection. Huh? It's only a bad position of the top of the thread. So this is the thread. So I exit it from 2 centimeters, and then I cut it and it's finished. It's only this. Okay, so now I know that the top of the thread will be very much back and deeper, so I will not have this problem again. So as discussion, advantages and inconvenience, for me, it's near only advantages because it's not a surgical process. So you can do it in your office. There is no incision. There is simple local anesthesia. I use lidocaine with adrenaline, 1% to 2%. There is no social eviction. I have many patients who go to the restaurant during the evening. There is no real pain, but they feel sensibility. So you can provide paracetamol, just using 1 gram a few hours after. We have a near immediate result, but it's a 3-on-1 technique able to improve with a strong effect the collagen and elastin. So this is for me a great thing. And the optimal result is after 2 months, but we must be learned carefully to put the thread in the right position. So thanks again to Murat, to George, to Constantine, to Luciano to give me the right information and the right way to put the thread. For the durability, it's near 18 months. Sorry for the mistake on the text, I wrote in French. And the studies that APTOS shows that only 41.2% of the thread is resorbable after 72 weeks. So it means that it stays longer time. So it's a long-lasting effect thread. So it's possible to have some fall would disappear after a few days on big skin laxity. It's a very good combination to fillers. Only hyaluronic acid for the moment. I only mix the threads with hyaluronic acid, no other kind of filler, because I have no habits with other kind of filler and thread in this position. But I think we can use Sculptra also, or Ghana. I think polylactic acid could be mixed with the thread. Toxin botulic also, no problem. This is hypoallergenic threads, but it's still a foreign product, so pay attention on the certain kinds of patients who can have some allergy. And the few side effects, I show you the only side effect I had, it's extrusion and sensibility for 3 weeks, no more than this. And I think that infection must never occur because we clean carefully the skin and we explain to the patient that they have to follow good instruction after the process. So thanks a lot. The next webinar will be with Dr. Monika Kavkova and how she achieved maximum anti-aging effect with minimal reconvalescence. And I also want to thank you. I'm very excited to announce that APTOS and Chrysalis, the leading 3D imaging solution, have decided to work closely together to better support you. At APTOS, we are always looking for new ways to help our customers enhance their activity. With Chrysalis, we see a great opportunity to boost our value add by attracting, educating, and converting more patients to our innovative and advanced thread lifting methods. The last 15 minutes will be with, I think, Federico Roldao, or if you have some question. Thanks a lot.
Frederica?
Yes, hello. Hello, I don't know if you can see me. I don't hear anyone. Can you see me and hear me?
Yes, we can see you, yes.
Okay, good, perfect, perfect. So I'd like to thank both the doctor for the introduction and APTOS for the invitation. It's very kind of you. Yes, indeed, Chrysalix is now starting a relationship, a partnership with APTOS to provide APTOS doctors a better experience with their patients. Chrysalix very quickly is a 3D imaging system that allows any aesthetic professional, doctor, aesthetic doctor, plastic surgeons, etc., dermatologist, to create a 3D image of their patients and then to simulate any type of procedure on that 3D image. The main goals of this is to achieve a better communication with your patient, to manage the expectations better because you're showing the possibilities on the patient's own image. And also it works very well as a marketing tool because it's a great differentiator. Although it's spread all over the world and many doctors are using it, it's still seen as a new thing. So it can really make a difference in an area that you have several doctors doing the same work as you are. This is a very good and easy way to differentiate yourself. If you allow me, I will share my screen now. Can I do that?
Not yet, it's not shared. Did you tap on the green button on share screen?
No, can I do it now?
Yes, yes.
Okay, good. Okay. Can you see my screen now?
Yes, and click on the presentation mode.
Okay, good.
Yes.
So I'm now clicking on the presentation mode. Let me get my laser pointer here. Okay, so what you see here is a new way of creating the 3D that we've developed recently, and it came very handy because of the COVID restrictions that everyone had to suffer with. So every patient that visits the website of a medical professional, plastic surgeon, aesthetic doctor, they will find something like this if they have Chrysalix. So all they have to do is click the link on their mobile, and by clicking the link, they will be taken to a page where they will sign up with their name, email, and password. So they create their own account. So this is customizable. You can see that you can put your name and your clinic logo here. And then they are asked to create their own 3D, okay? So all they have to do is choose between breast and face. And today our focus will be in face, but Chrysalix can be used for face, for breast, and also for body, like for liposuction, tummy tucks, etc. So the patient is guided on how to take the photos, what type of photos she has to take, and then she takes the photos and she uploads the photos to the mobile. And then after that, she can start doing simulations. This is also something new. It's something that we didn't have before, but now we have the possibility for patients to do their own basic simulations to start the process. So the 3D is generated and then it's created, and the patient can play with the app and can do some easy simulations. So you see that she's doing something to the nose. She was straightening the nose, dorsum. She was playing with the tip now. She will narrow the nose a bit here. I hope you all can see what I'm seeing on my side. She's narrowing and widening the tip. Now she is playing with the tools that allows her to play with the lips. So this being a very easy way to engage your patient and to give your patient the power of starting to do something and then showing you what she would like to achieve. So on this patient app, that's very easy to use. So at the same time that your patient creates her own 3D, you will receive an email, and that email will tell you that you have a new patient. So all that you have to do is go to your Chrysalix license and then start simulating or book a remote consultation. Right now, we offer a way within our application for patients to have a remote consultation without leaving the application. So no need to be using Zoom or Skype, because Chrysalix is GDPR and HIPAA compliant. So everything is safe in that environment. So there's no need to leave that environment, and the consultation can be made here, okay? So let me stop sharing this screen here. And what I will do is share another one, which is the one that I have the 3D of my patient already done. Okay. I suppose you can see it. This is the 3D that the patient created herself. And just to give a little impression of what an APTOS thread would be on this side of the face, I did just a very simple simulation, which is this one. And you can clearly see that her face, her cheek is being lifted. But I will show you in more detail how this can be achieved. And for that, I will use a patient that has, I would say, more issues to deal with. And I will use this patient here. And I will just do some simulations on her so that you can easily see how it is done here with Chrysalix. So first of all, we have a very good tool that allows us to assess the patient's symmetry or lack of symmetry. So this is the patient if she was totally symmetric from right to left. And if I remove the transparency, that's her in real life, that's her symmetric. And this is the opposite, left to right. So real life and perfect symmetry, real life and perfect symmetry. And this allows you to better communicate with your patient and talk about her needs. Another tool we have, which I think is quite handy for anyone working in this area, is some measurements, some angles that we take automatically of the patient, and some specific measurements for the nose and mouth areas, so that you can manipulate and then compare the differences. We have the fifth rule, which shows you the 5/5 of the face and how the face is split, and also the thirds. So these proportions are quite handy to analyze the patient's face. And then from here, you can start doing whatever simulation. So I didn't take any specific criteria. I will just show you some tools to simulate on the patient a number of procedures. So using these curves, all I have to do is tap on the curve, select the range. So the larger the range, the more tissue I will move, and the smaller the range, the more detail I will work with. So I'm just playing with her nose a bit here. And I will probably do something exaggerated so that the difference is easy to see, although very subtle differences are often easy to see. So from the front, I could also enhance the lips and give her a bit more plump lips. I won't do too much here because we also have limited time. I could work on the cheekbones as well and raise them a bit like this. I could go on the eyebrows and do a little work there, a little lift. I could then go on the profile and I could maybe straighten the nose a bit, maybe not so much like this. I could again enhance the volume here, or maybe even a bit more here like this. I could work a bit on the neck And if I wanted to, also on the chin, I could further enhance and give projection to the lips, which I will here. And I will try to bring this up a bit because she seems to need a bit of stretching there. Okay, so I've done a few changes in these angles. I would work on this angle if needed as well here. And everything we do, it's very easy. If you don't like the effect, let's say I do something really exaggerated, I don't like this, all I have to do is go over there and undo and then redo again. So I could adjust the range, etc., bigger range, smaller range. All the tools, they may seem complicated, but they're actually very, very easy to use. Why not refine the nose a bit over there as well, because it seems a bit too wide. Okay, now what I will do is just show the before and after like this, and I hope you all can see the difference. It can be seen side by side, but it's easier to see like this. I could show it like this side by side, but I think it's better if we show it like this. After doing these changes with the curves tools, I will work on her skin a bit because some of the changes would imply some differences on the skin. So for instance, I could go here and smooth the skin a bit like this. And in this case, I will just work on one side of the face. So it's easy to see the difference between one side and the other. So just do a little smoothing there, a little smoothing over here as well. And then I will go under and I will go here to the lips area and do a little smoothing here as well, just half. And here she needs some work as well. So let's do it here as well. Okay, and I think her glabellar lines are a bit too pronounced, so they could work well with some treatment. So one of the big advantages of Chrysalics, and I want to say this before I show you the before and after, is that if you have a patient and she comes and says, well, can you do a thread lifting on my face? You can simulate the thread lifting, but you can also simulate other things like a treatment on the eyebrows, on the tear trough, on the nose, on the lips. And then the patient realizes how much better she would look if she would opt for doing a treatment plan instead of just one simple treatment. So this can be a very good tool for cross-selling. So let me show you the final result with the morphing of the shapes and also the smoothing of the face. And you can see that the changes are quite dramatic, but very easy to simulate. Let me zoom out. And I hope you all can see it. Now, I don't have access to the chat right now. I don't know if there are any questions, but at this point, I will be at your disposal if you have any questions. And that's it, and thank you. Hello? Hello.
Hi. Yes. So, thank you for your presentation.
Thank you for the opportunity. I can't see any questions. I don't have access to the chat right now because I'm still sharing my screen. So if there is any question, I'll be happy to answer it. I see a raised hand by Dr. Esperanza Gonzalez Sapeg. I don't know if she's raising the hand because she'd like to ask something.
Just raising the hand. There are no questions yet.
Okay.
I think they
Just raising the hand. Okay, okay.
very clear presentation. Thank you very much.
Thank you very much. And I think there is a special offer to all the attendees of this webinar. And I think APTOS will pass on this special offer to everyone after we're done.
So we'll post it on social media, and doctors, please keep updated. So,
good, good.
Thank you, Federico. Thank you, Dr. Essayagh, for the presentation.
Thank you.